Hello, my name is Elisa Webb, and my project is on chronic kidney disease in African Americans. The kidneys are important because they filter waste and fluid, they help maintain electrolyte balance and pH balance, and they also maintain blood pressure. The kidneys secrete a hormone that is responsible for stimulating the production of red blood cells. Kidney disease refers to a loss of kidney function either partially or wholly. Kidney disease can be caused by a number of factors, but the most common conditions that contribute to kidney disease are high blood pressure and diabetes. End-stage renal disease occurs when the kidneys no longer function enough to sustain life. Kidney disease progression can be delayed if it's detected early. There usually aren't symptoms to mild to moderate kidney disease, but severe kidney disease symptoms could include weakness, shortness of breath, swelling of the hands, feet, or face, nausea, and loss of appetite. The best way to test for early signs of kidney disease is a urine lab known as ACR, which estimates the amount of a type of protein, albumin, that is in your urine. Another lab test, also known as GFR, measures kidney function. This is generally used to determine the later stages of kidney disease. It specifies how fast the kidneys filter waste from the blood. GFR is measured based on an individual's blood creatinine level, height, weight, sex, race, and age. Prevention is the best form of treatment for kidney disease. Properly managing diabetes and hypertension is the best way to prevent the late stages of kidney disease. Chronic kidney disease tends to worsen over time. Keeping regularly scheduled doctor's appointments, taking medications as prescribed, and eating properly can help prevent the late stages of kidney disease. Speak with your physician about medications that are not filtered properly through the kidneys. Also, speaking with a dietitian about foods you should eat or avoid if you have diabetes or hypertension, or speaking to your dietitian about one's diet if you've already been diagnosed with kidney disease is very important. Individuals who smoke should stop smoking. In addition to all other effects of smoking, it can cause damage to the kidneys. There are three forms of treatment for end-stage renal disease, which are hemodialysis, peritoneal dialysis, and kidney transplant. Ten percent of the worldwide population is affected by chronic kidney disease. 26 million American adults have chronic kidney disease. African Americans constitute more than 32% of all patients in the U.S. receiving dialysis for end-stage renal disease, but only represent 13% of the overall U.S. population. Although race is not a determinant of chronic kidney disease, African Americans do have an increased risk of developing kidney failure due to the higher rates of diabetes and hypertension. The above mentioned diseases are the major risk factors for chronic kidney disease and kidney failure. In fact, African Americans are twice as likely to be diagnosed with diabetes as whites. According to one study, African Americans have up to a 4 times greater risk of developing end-stage renal disease compared to their white counterparts. Determinants. Socioeconomic status can affect how one is able to access resources to better care for themselves or others. Access to care and cost of health care are significant factors that influence racial disparities. Lack of economic resources is also associated with poor health outcomes such as diabetes and hypertension. In 2011, 35% of African Americans lived below the U.S. federal poverty level compared with 13% of whites. Researchers have found that African Americans who had incomes of less than $20,000 per year had more than 3 times the risk of chronic kidney disease than that of their white counterparts. The Jackson Hart study showed that affluent or highly educated African Americans had lower risks of chronic kidney disease relative to their poor and or less educated counterparts. Factors related to low socioeconomic status, such as less access to health care, insurance status, low literacy, and low income, have been associated with an increased risk of chronic renal disease. Another determinant I found toward kidney disease is homelessness. Homelessness presents significant risk toward kidney disease in African Americans. Caring for homeless people with chronic kidney disease presents unique barriers such as lack of dietary control, difficulty securing and storing medications, access to adequate health care, and limited transportation. Also, the homeless are less likely to adhere to health care recommendations due to their current circumstances. The homeless population tends to seek treatment when chronic illness is more advanced or when it is affiliated with securing basic human needs. Social environment. The Jackson Hart study also showed the relationship between marital status and chronic kidney disease. They found that married participants had a lower risk of developing chronic kidney disease. The researchers further asserted that classic social science states that social relationships can have a significant effect on individual well being. Environmental conditions such as lead exposure, exposure to certain industrial chemicals, and infectious agents are more prevalent in lower socioeconomic status areas. These exposures could be related to albuminuria and reducing GFR, which leads to kidney disease. Geography. The end-stage renal disease belt has emerged in the southeastern part of the United States from 1990 to 2000. The ESRD belt considers to be stretching from the mid-Atlantic states through Texas. Behavioral. Smoking is a risk factor for cardiovascular disease as well as for chronic kidney disease. Incidentally, cardiovascular disease can also lead to kidney disease. Smoking slows the blood flow to vital organs such as kidneys. Chronic alcohol use can damage the function of the kidneys. Kidneys filter harmful waste from the blood, and this would include alcohol. Too much alcohol consumption can cause high blood pressure and also causes kidney failure. One study showed that those who were in a lower socioeconomic status were more likely to report use of tobacco and alcohol products. Obesity. There is also evidence that obesity may be a risk factor for progressive renal injury. Individuals living in poverty areas are unable to afford healthy foods and expensive gym memberships. Low socioeconomic areas are also inundated with fast food restaurants and convenience stores. Stress. Stress caused by discrimination can be linked to poor blood pressure outcomes in African Americans. Psychosocial stressors such as low income, low education may lead to impairments in the autonomic nervous system's ability to respond appropriately, which ultimately can lead to negative health consequences such as chronic kidney disease. Finally, genetics. People who have a first or second degree relative with end stage renal disease are at an increased risk for developing chronic kidney disease as well. Low birth weight, which is prevalent in the African American population, is also believed to be a contributor to the racial disparities in end stage renal disease. And a gene encoding known as MYH9 has also been connected with non diabetic end stage renal disease in African Americans, but not in whites. This is the web of causation conceptual model. According to an article in the Social Science and Medicine Journal, social conditions such as social class, education level, income, and race have been considered significant causes of chronic illness because of unequal access to health care and disease prevention resources. One recommendation out of the above study is for social justice advocates and disease prevention specialists to address the socioeconomic inequalities that cause kidney disease. Fresenius Medical Care LaGrange is one of 3 dialysis clinics in Troup County. Hemodialysis cleans and filters the blood via an artificial kidney, which is also known as a dialyzer. It cleans the blood of waste and excess fluid. It also helps control blood pressure and the proper balance of electrolytes such as potassium, calcium, sodium, and chloride. This clinic receives referrals from area nephrologists as well as the community hospital, and they serve the ESRD patients in Troup County. Fresenius LaGrange in-center hemodialysis serves 66 patients. 56 of those patients are African American. The average cost for providing care for patients receiving dialysis is $45,000 per year. The goal for FMC LaGrange is to treat all patients equal and provide the best treatment outcomes possible. This clinic employs nurses, patient care techs, social workers, and dietitians. It provides medical care as well as psychosocial and educational resources. Each dialysis clinic is surveyed by the state at least every other year unless there is a complaint made by a patient. This clinic is also measured each month by their clinical outcomes. This internal survey is a Fresenius corporate measurement. FMC was surveyed in March 2015 by the state with no citations, and their March clinical outcomes were within range as compared to other Fresenius medical facilities. A health-related policy that I found was the Comprehensive Immunosuppressive Drug Coverage for Kidney Transplant Patients Act of 2013, which has not yet been passed. This act would extend Medicare Part B coverage for kidney transplant patients for the purpose of immunosuppressant drugs only. The most effective form of treatment for ESRD patients is kidney transplant. However, most of the individuals are unable to afford the costs associated post-transplant. After receiving their transplant, Medicare will only pay for the cost of medications for 3 years post-transplant. If they become no longer eligible for Medicare, they cannot afford their cost of medications. The purpose of this bill is to extend Medicare's coverage of immunosuppressive drugs beyond the 3-year period. In conclusion, chronic kidney disease can be caused by many factors, which include socioeconomic status, homelessness, behavioral, obesity, geography, stress, and genetics. African Americans are more likely to develop chronic kidney disease and represent the majority of the ESRD population. Disease prevention and social justice should address the socioeconomic inequalities that cause kidney disease. And these are my references.